Okay, so let's dive into something that I think a lot of people are curious about. Sex during pregnancy. It can be a little bit mysterious.
It is. It's one of those things that, people don't always talk about.
Right. You send in some really great sources for us to look at today from the NHS, the NCT, the Mayo Clinic, and Medical News Today. So clearly you've done your
Yeah,
research
it's fantastic.
and you're looking for answers. We're going to give you those answers. We're going to do a deep dive into what's safe, how things might change for you, and some practical tips for how to handle intimacy throughout your pregnancy.
Absolutely. And I think a really good place to start is with safety, because one of the things that I know a lot of people worry about is it even safe to have sex during pregnancy? And all of our sources are crystal clear on that point. It is absolutely generally safe to have sex throughout a healthy pregnancy.
That's reassuring to hear.
Yeah.
But why is that? I mean, you have a whole other human being in there.
You do, and it's well protected. Your body is designed to protect that baby. That amniotic sac that the baby is in acts as a cushion. The muscles of your uterus are strong and they help to keep the baby safe. And then you have that mucus plug that seals the cervix, and it really helps to protect against infection.
So it's like a fortress in there.
It really is.
So all those myths out there that you might hear about sex hurting the baby or inducing labor, that's just not true.
Not at all. The baby is very, very well protected. And as for inducing labor, unless your body is ready to go into labor, sex is not going to start that process
That's true.
for
Good
you.
to know. What about Braxton Hicks contractions, though? I've heard of
Yeah.
those. Are those something to be concerned about?
Not at all. Think of those as just practice contractions. It's your uterus getting ready for the big event. And sometimes, particularly later in pregnancy, you might notice those after an orgasm, but they are perfectly normal.
So just your body getting ready. Yeah,
Hmm,
the NHS even suggests some relaxation techniques or just simply lying down if you feel that.
exactly.
Yeah.
Just taking a moment to just be present and listen to your body.
Now, are there any situations, though, where maybe a healthcare provider might advise a little bit of caution when it comes to sex?
Yeah, absolutely. Because every pregnancy is different. There are some specific situations where you might want to be a little bit more cautious. So the sources that we looked at mentioned things like if you've had a previous preterm labor, or if you have a condition called placenta previa, where the placenta is covering the cervix, or if you're experiencing any bleeding or leaking of amniotic fluid.
So basically, if you're ever unsure, talk to your doctor, talk to your midwife.
Always a good idea.
Okay, now let's move on from safety and talk about something a little bit different. Desire libido. Because let's be real, pregnancy hormones can really affect things in that department.
Oh, absolutely. It can
Right.
be a real roller coaster.
Some people might find that they are more in the mood than ever before. Others might find that they have zero interest. What's normal?
Honestly, both of those are completely normal. And it really comes down to the fact that pregnancy is a huge hormonal shift. And so those hormones are going to affect you in different ways. And for some people, that increased blood flow to the genitals and the heightened sensitivity that can come with pregnancy can really increase libido. But then on the other hand, you've got the fatigue, the discomfort, maybe some body image changes that come with pregnancy that can have the opposite effect.
It's a mixed bag for sure.
It really is.
And we can't forget about the partner, too. Their libido might be affected as well.
Absolutely. They might be feeling a lot more attracted to you than ever before, or they might be struggling with their own anxieties about the pregnancy or uncertainties.
So it sounds like communication is key here.
It really is.
Yeah.
Yeah, check in with each other. Talk about how you're feeling. Find ways to connect, whether that's through physical intimacy or other forms of affection and support.
It's about going through those changes together as a team.
Exactly.
So let's get into some practical tips for how to keep the spark alive throughout pregnancy. How about that?
I think that's a great idea. Because even if you are feeling in the mood, things might feel a little different physically, just given all the changes that are happening.
Exactly.
It's a little different. Yeah.
Yeah, so that's where these sources come in, and they've got some good advice for us. I'm looking specifically at the NHS and Medical News Today here. They've really emphasized that it's important to explore new positions as your pregnancy progresses. Find what's comfortable, find what feels good.
Yeah, and what works for you, because some positions are going to be a lot more comfortable than others as your body changes. So, for example, a lot of people find that side-lying positions are really comfortable during pregnancy because it takes the pressure off your belly and it can also improve blood flow.
That makes sense.
But-
And what about woman on top? Is that a good option too?
Absolutely. Woman on top can be great because it gives you more control over the depth and the pace, and that can be really helpful as your belly grows.
So you're in control.
Exactly.
Okay, now our sources also talk about using pillows for support. Is that something you recommend?
Oh, absolutely. Pillows are your best friend during pregnancy in general, but definitely in the bedroom as well. You can use them to elevate your hips, support your back, or just kind of find the right angle for comfort.
Make yourself comfortable.
Yeah, make a little nest.
Okay. And speaking of being cozy, the sources also talk about lubrication. Now, a lot of women find that pregnancy actually increases lubrication naturally. But is it okay to use additional lubricant if things are feeling a little dry?
Absolutely. There's no shame in using lubricant at all, and it can really make a big difference in terms of comfort and pleasure.
All right, so we've got positions, we've got pillows, we've got lubrication. Any other practical tips we should keep in mind?
Well, it's always a good idea to remember the basics of safe sex, particularly if you have a new partner or multiple partners.
Right, because STIs are still a concern during pregnancy.
Absolutely. The NHS and the NCT both talk about that condoms are really essential for protecting both you and your baby from sexually transmitted infections.
It's a simple step that can make a big difference.
Yeah, for sure.
Okay, now while we're on the topic of safety, let's touch on oral and anal sex briefly.
hmm
Are those considered safe during pregnancy?
Generally speaking, yes, both of those are considered safe. However, there is one important caveat with oral sex. The Medical News Today article mentions the risk of air embolism, which is a rare but serious condition that can occur if air is blown into the vagina.
So oral sex itself, fine blowing air into the vagina, not so much.
Exactly.
Mm.
It's always better to err on the side of caution.
All right, good advice.
hmm
Now, we've talked a lot about penetrative sex, but it's important to remember that intimacy isn't just about that. There are so many other ways to connect with your partner and feel close throughout pregnancy.
You're absolutely right. And in fact, exploring those other forms of intimacy can be incredibly rewarding and really help to strengthen your bond as a couple.
What kind of activities are we talking about here?
Well, things like cuddling, massage, mutual masturbation, those are all really wonderful ways to foster intimacy and pleasure, even when penetrative sex isn't possible or isn't desired.
So finding ways to still be physically and emotionally close?
Exactly. And it really requires you to communicate, to explore, and to be vulnerable with each other. And that can deepen your connection in so many ways. And honestly, who doesn't love a good cuddle or a massage?
Especially during pregnancy, when your body just wants to be comfortable.
Exactly.
Now, sometimes even with the best of intentions, things don't always go as planned.
That's true.
Pregnancy can be an emotional roller coaster, and it's not uncommon for couples to experience some challenges in their relationship.
Absolutely. It's a huge adjustment.
So how can couples navigate those emotional ups and downs and make sure they're supporting each other throughout this journey?
It's a big question. It really is. I mean, it's no secret that pregnancy can be a whirlwind of emotions, not just for the person carrying the baby, but for their partner as well.
Absolutely. It's a time of such immense change, both physically and emotionally, and sometimes those changes can really put a strain on a relationship.
So, where do we even begin? How
Yeah.
can couples kind of navigate all of that and make sure they're supporting each other? Well, I think it starts with communication. And I don't just mean like the day-to-day stuff, like doctor's appointments and, who's going to pick up the groceries. I mean, really tuning in to each other's feelings and needs and concerns.
Making time for those conversations,
Mm,
even when you're exhausted and the to-do list feels a mile long.
exactly. Creating a safe space where both of you feel comfortable expressing those vulnerabilities,
hmm
you know, talking about your fears, your joys.
Being honest.
Exactly.
And it's not just about talking, though, right?
Mhm.
It's also about showing up for each other in those meaningful ways.
Absolutely. Small gestures can go such a long way, offering a back rub, taking on some extra chores, or even just being present and listening without judgment.
Just making that person feel seen and heard.
Exactly.
And sometimes that might even mean seeking professional support.
Yeah, absolutely. There is no shame in reaching out to a therapist or a counselor if you're feeling overwhelmed or if you're just really struggling to communicate. They can give you some tools to help you navigate those challenges as a team.
So as we wrap up our deep dive into sex during pregnancy, let's do a quick recap of some of the key takeaways.
Okay. So first and foremost, sex is generally safe throughout a healthy pregnancy. Your body knows what it's doing. It's designed to protect that baby. And those old wives' tales about hurting the baby or inducing labor, they're just that. They're tales.
But it's always a good idea to listen to your body and to consult with your healthcare provider if you have any concerns or any unusual symptoms.
Exactly. They can give you the best advice for your specific situation.
And we also talked about how pregnancy hormones can really affect your libido.
That's true. It can go up, it can go down. It's a wild ride.
It really is. But the important thing is just communicate openly with your partner. Find ways to connect, whether that's through physical intimacy or other forms of affection and support.
And remember, there's so many different ways to be intimate. We talked about cuddle and massage, mutual masturbation. It's all about finding what feels good for both of you.
And being open to exploring new things.
Yeah.
So as we close out this deep dive, I want to leave you with one final thought-provoking question. How can you and your partner best communicate about your needs and desires throughout your pregnancy?
Because that open and honest communication is really the foundation for a strong and loving relationship.
Pregnancy is a unique journey full of incredible highs and lows. So embrace the changes, communicate openly, and most importantly, enjoy this special time.